Preliminar interview of the patient. When a therapist makes an appointment, he should ask the patient about his health problem. The therapist should be able to tell the patient what are the chances of having his disease successfully treated with biomagnetism. This brief interview will also help the therapist to better prepare for the session. The therapist can draw up a short list of questions for the patient. These questions can be made by phone or by having the patient fill out a form. The patient can be asked to give the following information: personal data, symptoms or current health problems, current medical diagnoses, illnesses and surgeries the patient had in the past. Depending on what the patient's answers are, the therapist may ask other questions regarding diet, lifestyle, medications the patient is taking, marital status, employment, emotional and affective state, or any other issue that may be relevant. Once the therapist has a picture of the patient's history, he or she can start scanning the body. It is very important to note that it is not really necessary asking the patient all this information before the scanning takes place. It's just convenient to be familiar with the patient's context and to better understand that pathological case. But the spirit of biomagnetic pair therapy is not being influenced by symptoms or diagnoses that the patient brings. That is, the therapist should check each and every one of the scanning points from first to last. He should not put magnets according to formulas associated with symptoms or induced by what the patient has told during the interview. Some good therapists even read the patient's history only after having scanned the patient's body, so to ensure that scanning has been impartial and objective. And then he can try to justify why the patient had these symptoms when he reads the clinical history after the session. Surely some pairs located at specific points on the body are more suspicious than others to produce certain problems, but a good and effective therapist must check absolutely all of them. Any biomagnetic pair may in principle be altered, even if it is located far away from the area where the symptom is. The scanning of the patient should be complete in each session.